Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Hello, a very warm good evening to all of you. I'm Dr. Srijna, and today we are delighted to have you all join us for today's webinar, organized by Drools in collaboration with Indian Association of Veterinary Dermatology, IAVD. Thank you all for taking the time to attend this session. And to begin, we have Dr. Nagarajan to deliver the welcome address and set the stage for today's session. Over to Dr. Nagarajan.
Hi, good evening to everyone. On behalf of Indian Association for Veterinary Dermatology and our knowledge partner, Drools, that is VetPro Drools, we welcome you all for this important webinar in dermatology. There is Cutaneous Manifestations of Systemic Diseases in Dogs by the great experienced Dr. Mohanambal. See, before that, I request all of you to register for our ICVD 5, that is Indian Congress for Veterinary Dermatology. That is 5th one, which is going to happen in 4th to 6th June of 2026 at ITC Royal Bengal, Kolkata. Those who are not registered, please register immediately. And even for the workshop, we have a very less number of persons, so you can immediately do that, otherwise it will get filled. So I request all of you to do that. Those who are interested to come for workshop also, you can come. And I request our Drools team to introduce our speaker, Dr. Mohanambal, for this webinar. Thank you.
Sure. Thank you, sir, for the introduction. So now, before we start, I would like to request everyone to please fill out the forms in the comments box to receive your participation certificate for today's webinar. And now it's time to introduce our esteemed speaker, Dr. Mohanambal. Dr. Mohanambal is accomplished veterinary professional, currently serving in the Department of Veterinary Clinical Medicine at Veterinary College and Research Institute, Namakkal, under Tanvas University, Chennai. She has completed her BVSc and AH in 2009, followed by an MVSc with distinction in veterinary epidemiology and preventive medicine in 2012. She earned her Ph.D. in veterinary medicine with distinction in 2023 from PVNR TVU University, Hyderabad. And ever since from 2015, she has been serving as assistant professor and is actively involved in clinical practice, research, and academic contributions with a special focus on canine dermatology. And now, with this, we hand it over to Dr. Mohanambal for her expert session on cutaneous manifestations of systemic diseases in dogs, recognize skin patterns that signal underlying systemic illness and guide timely diagnosis. Over to Dr. Mohanambal.
Good evening to respected professors, colleagues, friends and my dear students. Today we are going to see about a very important topic, that is cutaneous manifestation of systemic diseases in dogs. I will start with a simple analogy. If a family is having a twin, it is easy to identify by the family members, friends and close relatives. But same time it is very tough and difficult to identify the persons by an unfamiliar and third person. Similarly, cutaneous manifestations of skin is easy to recognize by the dermatologist. It is tough to recognize by the owner and others. So we need to enhance our skills to identify. The skin will show us a mirror and shine that we need to know and recognize. So there are primary lesions and systemic diseases will exhibit through skin as a secondary lesion. It is very tough to recognize or differentiate between primary and systemic disease lesion. So for this, definitely this session will help you. So skin reflects the internal health. It is the early indicator for the underlying systemic distress. But skin has limited way of express its problem, because for everything skin will have to express its as a papule, pustule and secondary lesions like crust and all. Whatever may be, it is a primary lesion or secondary lesion, skin will express in a same way. So it is up to us to identify the lesion. That is a tough and toughest situation when you are choosing or diagnosing a disease, because skin show so many signs and the signs and signals are fluctuating. Many systemic diseases definitely will give a clue through dermatological sign. So how to unreveal the clues? Definitely skin will give us a clue. It is up to us to open up the clue and identify the actual lesion. Initially, thorough history is the key to unlock the clue. So we have to ask the owner proper history. That is very much important. We need to ask the development of lesion, where it is started initially. We have to ask the owner what about the age of the animal, because some of the dermatological disease will start its initial course. For like Cushing's disease, it will start in later age of life, like above 7 years old. And sex, gender is very much important. Some disease will affect only male animals and some will affect only female animals. So we need to ask about thorough history and when the lesion started, and importantly, initially pruritus is started or it is a non-pruritic lesion, and the location of lesion, where the location of lesion started initially. It is started near the head region or facial region or paw region or mucocutaneous junctions. That is a very important history, and you should not omit the routine diagnosis. As a experienced clinician or dermatologist, by seeing animal skin, he can or she can able to diagnose the disease very immediately. But we should not jump into the actual diagnosis. We have to proceed with the proper diagnostic approach. Initially, we have to do with skin scraping examination, cytology, then followed by culture and cultural examination or histopathological examination. At any time, we should not miss the routine diagnostic procedure, because definitely it will guide and clue us, give a clue to identify the actual cause. And physical examination. Systemic disease is concerned. Skin is a mirror and it will give us clue to identify actual lesion. But always systemic disease will have some systemic abnormality definitely. So by seeing skin itself, we should not arrive a diagnosis. We have to see the internal organs, because systemic illness not only affect the skin but also affect other internal organs. So examination of internal organ is much more important to diagnose a systemic infection. And waxing and waning signs, this is very important, because when problem is primarily with the skin, you are giving right treatment, the clinical signs will alleviate in due course of time. Whereas if you are giving treatment, again and again the animal showing clinical signs, that is recurrence is there, that is called as waxing and waning of signs. It is a great clue for a veterinarian or clinician to identify actual cause. The skin is telling that some problem is there inside my body, please look into it. That's what skin is saying to us. And lesion distribution. So distribution of the skin pattern, there may be bilateral symmetrical alopecia, or the alopecia may be non-symmetrical. Bilateral symmetrical alopecia is very common in Paraneoplastic syndrome, because we are all very well know that bilateral symmetrical non-pruritic alopecia is common in endocrine disorders like hypothyroidism and Cushing's disease. Apart from that, allergies and paraneoplastic syndrome will also show bilateral symmetrical alopecia, and non-symmetrical alopecia is there. It means that animal is showing lesion or problem in a particular area. There may be problem with parasitic infestation or bacterial infection or some other problem is there in the body. So this particular session we will be seeing an important differential diagnosis of systemic diseases, which will be giving us clue through skin. The primary one is endocrine disease. Importantly, we will discuss about hypothyroidism and Cushing's disease. Apart from that, other few diseases. Metabolic disease is concerned, we will be going to see about hepatocutaneous syndrome. It is very much important. In case of hepatocutaneous syndrome, we will be seeing lesions in mucocutaneous junctions, underside of the body, and we can able to see the crusty lesions. Infectious disease, definitely infectious disease also give us a clue, but in case of infectious disease, the lesion is, as I said, it is a non-symmetrical lesion. Lesion will be there in some area of the body. Example of infectious disease: canine distemper, leishmaniasis, canine babesiosis, ehrlichiosis, and some other diseases. And importantly, immune-mediated disease, none other than Pemphigus fallacius, systemic lupus erythematosus, and cutaneous adverse drug reactions. These are all the diseases we will be seeing in immune-mediated dermatosis session. And deficiency diseases, definitely if animal or everyone having deficiency, our skin is a clue to identify the internal deficiency. In canine population is concerned, vitamin A responsive dermatosis is very much important, where we can see the dullness of the skin. Skin will have scaly and crusty lesions. And neoplasms, definitely paraneoplastic syndrome will show bilaterally symmetrical alopecia lesion, and it won't respond to your treatment. This is very important to identify paraneoplastic syndrome. We will move on to one by one. First one is endocrine disease. Many hormones will affect skin and adnexia, and importantly, all the endocrine diseases we will able to see initially non-pruritic alopecia. Initially there may or may not be a hair loss, but the pattern of alopecia will be symmetrical bilateral. Bilaterally symmetrical non-pruritic alopecia is the tell us it is a disease of endocrine disorder. The important one is hypothyroidism. Hypothyroidism, we can call it as great impersonator disease, because it will show a lot of dermatological signs which will be confusing us to identify actual hypothyroidism. If animal shows a rat tail appearance, it is easy to identify and spot it is a canine hypothyroidism. Whereas in canine hypothyroidism, not only bilateral symmetrical alopecia, sometimes we will be seeing nasal planar alopecia, circular alopecia, generalized hair loss, and there will be a alopecia of neck region or alopecia of the back region. These are all some sign where we can observe the patient of hypothyroidism, because this thyroid hormone receptor will present in sebocytes, outer root sheath of the hair and dermal papilla. So wherever thyroid hormone deficiency is there, there will be a hair loss. So all the time it may not be a symmetrical hair loss. Sometimes you can observe hair loss in the pressure points. So it is duty of the clinician to identify actual internal cause. So alopecia in hypothyroidism is always not typical one. And how then we can identify a case of hypothyroidism? In hypothyroidism, there will be a waxing and waning of lesion will be there. Seborrheic changes will be there. And there may be focal, multifocal and generalized lesion. By seeing too many cases, if you have doubt, you have to go the assessment of hormone level, or you can give treatment and check for the response. These are all few cases where you can see in the initial case, first one, you can able to see the interdigital furunculosis. It is a chronic interdigital furunculosis. This dog is presented to us for so many months with only a lesion in the interdigital space. So we are treating the case with antibiotics based on ABST. It is unable to cure completely. Then we have went for hormonal assessment, identified that the dog is having thyroid hormone deficiency. Then we have treated it rightly. And the B image, this animal is presented with recurrent otitis. So recurrent otitis also give us a clue to identify a case of hypothyroidism. And the third image, C, alopecia of only back region and tail region. This animal don't have a typical rat tail appearance, but with the help of hormonal assessment, we identified that this dog is having hypothyroidism. And the fourth dog, image D, has generalized crusty lesion. With our experience, we have identified that this case is hypothyroid, having a lower level of thyroid hormone. By supplementation, the hair grown normally. So these are all some atypical cases where we have to look in very clearly. And this is the differential diagnosis for hypothyroidism. In the initial A image, the animal shows hyperkeratosis, bilateral symmetrical alopecia. This is non-pruritic alopecia only. And the image B also, it is having a clear epidermal colorate and alopecia all over the body. Generalized alopecia was there. So usually we will identify the case vice versa. The first case we will think it as a hypothyroidism case, and the second case we will think that as a pyoderma case. But this is vice versa. This case was responded to antibiotic therapy very well within 7 days, and the hair growth was normal. Whereas the B case was not responded to actual antibiotic therapy. It was responded to the thyroid hormone replacement therapy. So this is how our clinical importance lies. So it is duty of the clinician to identify and focus on the dermatological lesion. We have to look into, see the lesion very clearly and describe the lesion properly. And next important disease is Cushing's disease. Here the excess level of cortisol leads to thinning of the skin. And another important clue is in case of there are two types of Cushing. You all very well know that pituitary associated Cushing's disease and adrenal associated Cushing's disease. Functional adrenal tumor, if dog is having functional adrenal tumor, you can able to see the clitoral hypertrophy. This is very important clinical sign. And because of immunosuppression, these dogs are prone to demodicosis infection. And if you see the skin of the animal, the skin will be thin and numerous comedones will be visualized in the animal body. In this image, you can see the prominent abdominal vasculature, and the second image you can see numerous comedones in the ventral abdomen. This is very classical for hyperadenocorticism or Cushing's disease. In Cushing's disease, another important clinical sign is, apart from dermatological lesion, animal will express PU and PD, polyuria, polydipsia and polyphagia. So this is important systemic sign where animal also exhibits. So apart from dermatological sign, we have to look into the systemic sign also, so that we can able to rightly identify the Cushing syndrome. And the Cushing syndrome will usually occur in animals of above 7 years age group. That is very important. And coming to the differentials, so this is two images presented in front of you. The first image, a mongrel dog presented to us with waxing and vanning lesion. This animal not respond to any kind of antibiotic therapy. But the second case, it is having typical calcinosis cutis. But the two cases, if you are see from the distance, it looks it is having calcinosis cutis. First image is alopecia X. It is biopsy responsive, and the animal has responded to our supplementation therapy very immediately. Whereas this is calcinosis cutis case because of Cushing's disease. And another important disease is sex hormone dermatosis. Usually in sex hormone dermatosis, there is absence of systemic clinical signs. So the sex hormone excess may be because of gonadal origin or adrenal origin. In case of sex hormone dermatosis, usually we will be able to see the alopecia in the truncal region, or sometimes alopecia may be generalized and regionalized. In case of hyperestrogenism, there will be a feminization syndrome in case of male dog because of functional tumors of testicle, mostly Sertoli cell tumor or interstitial cell tumor. And intact female dog also, there will be a generalized alopecia and numerous comedones and melanosis will be there. This is because of cystic ovary or ovarian tumors, all because of excess estrogen. And hyperandrogenism, you can able to see many dogs, there will be a circumscribed anal gland enlargement will be there, or tail gland hyperplasia will be there. If you do castration, these signs will vanish very quickly. This is because of interstitial cell tumor. And hair loss associated with irregular cycles in case of intact females. This is very common in miniature poodle, terrier, dachshunds and German shepherd breeds. Usually these female animal, intact female, will go for pseudo pregnancy. This is very common physiological phenomena, but those time animal will show the signs of alopecia around collar region, rump and mammary region, and the alopecia will be there mostly in the back side of the animal body, perineum, rump and mammary region. This is because of irregular cycles in case of intact females. It is our duty to identify the clinical signs expressed by the animal. Usually these signs will be there at the time of pseudo pregnancy, and this will vanish with right treatment. Idiopathic male feminizing syndrome, it may be occurs because of tumors. Initially these kind of cases we have to ask history. In case of idiopathic male feminizing syndrome, pruritus is the first clinical sign. It will precede the skin lesion. Usually if animal is having non-pruritic alopecia, that is endocrine dermatosis. If it start with pruritus, it may be idiopathic male feminizing syndrome. It is because of estrogen excess. And sometimes in addition to the hormone, food hypersensitivity, malassezia hypersensitivity also cause idiopathic male feminizing syndrome like signs. Hair cycle arrest. This is very important disease with unknown cause. It occurs in few breeds like Pomeranians, Chow Chows and Alaskan Malamutes. The other names of hair cycle arrest is adult onset of growth hormone deficiency, growth hormone responsive alopecia, castration responsive alopecia, biopsy responsive alopecia or alopecia X. These are all the other names for hair cycle arrest. So this is a dog presented to us with no growth of hair. So no pruritus in this animal. What we did is we have treated with antibiotic, animal was not responded. So we have taken a biopsy. This is the biopsy site you can able to see. So in the biopsy site we have observed hair growth. Then we have supplemented with omega-3 fatty acids and vitamin A. The animal was responded to therapy very immediately. Within a month, animal has shown response, and within 3 months, animal attained this stage. We have not identified any classical diagnosis in this case, so it was classified under hair cycle arrest. Diabetes mellitus. Diabetes mellitus also important endocrine disorder. Usually in case of diabetes mellitus, it will show classical clinical signs, polydipsia, polyuria and hyperglycemia. Apart from that, animal will show pyoderma lesion and seborrheic skin lesion. The skin will be having hypotonic. So with varying degree of alopecia will be there. And next we will be moving on to metabolic dermatosis. Skin act as a mirror for internal metabolic status. So it is our duty to recognize the timely diagnosis is very important, so that we can avoid life-threatening internal diseases and we can improve the prognosis of the case. So hepatocutaneous syndrome is very important metabolic disease in case of canines. It is otherwise termed as necrolytic migratory erythema and metabolic epidermal necrosis. This hepatocutaneous syndrome occurs 99% because of liver diseases and very rarely occurs because of glucagonoma, that is pancreatic tumor. So this disease, how you can identify? You can identify this disease by ultrasonography. If animal shows skin lesion in the mucocutaneous junction, especially muscle area, facial area, limb area, distal limb and foot pad. This is a classical area where you can identify the lesion, crusty lesions, and lesion also seen in mouth, ear pinnae, external genitalia, hawk regions and ventral abdominal region. If you have these kind of clinical signs, immediately you can go for ultrasonography. These are all the classical lesion. Bilaterally symmetrical alopecia involving the mucocutaneous junction, pressure points, foot pads. This is hallmark for hepatocutaneous syndrome. Ultrasound, the pathognomonic lesion is honeycomb pattern or Swiss cheese pattern. This is characteristic of hepatocutaneous syndrome. It shows fibrotic end stage liver disease, but all the hepatocutaneous syndrome you cannot able to identify this pathognomonic lesion. If you can identify the honeycomb pattern in liver, this is pathognomonic to identify the hepatocutaneous syndrome. But every case of hepatocutaneous syndrome you may not identify the problem in liver. Some cases it may be a problem with pancreas. You have to see pancreatic tumor. You have to compare it with the clinical signs expressed by the animal. And next comes infectious disease. Infectious disease, definitely it have clinical important, and early recognition of infectious disease is very much important because it will cause systemic infection. If you are not identifying the disease in early stage, it is tough to save the life of the animal. So timely identification helps in targeted therapy. So that's why we need to identify infectious diseases very quickly. Dirophalariasis, it is very important to identify. It will show the skin lesion. Dilophorelia repens is very common in South India, Tamil Nadu, Kerala, Karnataka, whereas IMIT is common in Arunachal Pradesh like area. These repens mainly shows clinical signs related to skin, whereas IMIT's case also will show the clinical signs in skin. We can able to see ulcerative dermatitis, scabies like lesions you can able to see in Dilophorelia cases. In animal will show nodular pruritic skin lesion if it is having heartworm inside. And some of the animal, if it is going for bathing in the pond region, it will show dermatitis lesions that may be a cystosoma dermatitis, that is cercarial dermatitis. The cercaria present in that pond will penetrate through the skin of the animal and produce macules and wheals within 15 to 20 hours. Animal have severe pruritic lesion. Here history will help you to identify actual cause of dermatitis. Canine distemper, we all very well know that all the young puppies which is having canine distemper will be having ventral abdominal pustule, which should be differentiated from general impetigo or simple pyoderma because it is playing with the mud area. Whereas older dogs also, canine distemper is important differential because it will show lesions in the nasal and footpad area. It will show hyperkeratosis of the nasal planar area and footpad hyperkeratosis, which should be differentially diagnosed with Pemphigus foliaceus, systemic lupus erythematosus, drug eruptions and leishmaniasis. So that's why this canine distemper is important. And canine babesiosis. Canine babesiosis, we are all very well know that it will show petechial and ecchymotic hemorrhage. So animal is having simple pyoderma, with diascopy it will vanish, whereas in babesiosis it will be having severe vasculitis and ecchymotic patches, babesiosis and ehrlichiosis both. With diascopy it won't vanish. It means that animal is having some systemic illness. It may enter into disseminated intravascular coagulopathy. Sometimes babesiosis animal will show skin lesion also. There will be a crusty lesion in the footpad area and ulceration in the paw region. This is recorded by some authors. These canine babesiosis also can show lesion in the skin. Ehrlichiosis also, apart from the ecchymotic patches, animal will show crusting facial dermatitis involving the bridge of the nose, and pustular and purpuric lesions will be there. And because of the immune suppressive nature of the disease, there will be a recurrent pyoderma in Ehrlichiosis dog, which will be recorded in German Shepherd dog mainly. Leishmaniasis, it is very important disease, mainly North Indian area. Skin lesion occur over 80% of the dogs. In case of leishmaniasis, there will be a ulcerated nodular lesion, and nasal and periocular depigmentation is the classical sign in case of leishmaniasis. Apart from that, exfoliative dermatitis, silvery white asbestos-like scaling will be there all over the body, and anchocryposis will be there. And nasal depigmentation also will be there. That's why this should be differentiated from other diseases which is causing lesion in the nasal planar area. Now coming into immune-mediated dermatitis. In case of immune-mediated dermatitis, animal body is reacting against its own immune system. So there is a dysregulation of immune system. That's why attacking against self-antigen, we need to identify the systemic signs shown by the dog which is having Pemphigus foliaceus and all. And here we have got one case which is a case of lymphoma. We are treating with prednisolone. So the animal next day developed severe systemic illness. So it shows that that animal developed some systemic illness because of prednisolone. Prednisolone is toxic to that particular animal. So drug allergy was there in that animal. So we may think that prednisolone is a non-allergic drug. It will respond. It will be taken by every animal. Nothing will happen. But prednisolone itself will cause systemic signs in a dog. That dog was even collapsed. And Pemphigus foliaceus mainly common in Akitas and Chow Chows. Apart from that, Cocker Spaniel, Dachshund, Labrador, and recently English Bulldog also predisposed to this Pemphigus foliaceus. In case of Pemphigus foliaceus, we can able to see bilaterally symmetrical lesion. Mainly these lesions will be there in the eye, nasal planar area, foot pads, and you can able to see fissures and crusting lesions. Lupus erythematosus, the key sign are facial depigmentation, erosions, ulcers in the mucocutaneous junction. Here you can able to see the blistering skin lesion. This is very peculiar. And adverse drug reaction. I have a clinical experience here. We have treated a pug dog because it was suspected to have canine babesiosis. We have given a shot of prednisolone on first day. Next day, animal has developed vasculitis and purpura sign like this. We couldn't able to save the life of the animal. So each and every drug, when you are choosing, that animal may or may not respond to the particular drug. One drug may be okay for one animal, same drug may cause adverse reaction in another animal. Especially your anti-cancer drugs, immunosuppressive drugs will cause alopecia and purpura and poor wound healing property. Even the authors were recorded that doxorubicin and glucocorticoids, penicillins, even cephalosporins will have cause cutaneous drug reaction. So what drug we are giving previous day, we should remember, and animal comes with any skin lesion, we need to think about adverse cutaneous adverse drug reaction. Next important one is deficiency diseases. Deficiency disease, definitely if animal is healthy, the skin will be glowing, skin will be shining, there will be a glowing coat. But if animal is having some deficiency, the skin will have dull coat. Animal will have crusty lesion over the body. So dry, scaling, crusty lesion is the classical for deficiency diseases. We have recorded many cases of vitamin A responsive dermatosis. This is very common in such breeds like Cocker Spaniels, Labrador Retriever and Miniature Savanna. There is a marked hyperkeratotic plaques will be there all over the body. Scaling and crusty lesion with patchy alopecia will be noticed all over the body, especially in the ventrum of the neck and dorsal skin area. Apart from the skin lesion, animal will be healthy, their routine habits will be normal. So if that is the case, we have to think about the deficiency diseases. Zinc responsive dermatosis, this is not common, even it will show nasal hyperkeratosis. Whenever the case comes with nasal hyperkeratosis, we need to think zinc responsive dermatosis also. And next important disease is paraneoplastic dermatosis. Usually when you are treating a skin disease, animal is not responding to your treatment, then you have to think about paraneoplastic syndrome. So dermatosis will occur even tumor cells are not there in the skin. And paraneoplastic dermatosis, animal will show symmetrical non-pruritic alopecia. If animal shows symmetrical non-pruritic alopecia, it may have endocrine dermatosis or it may have some tumor inside its body. And here the classical sign is foot pad hyperkeratosis, and lesion will be there in the mucocutaneous junction. If it is there, it will be showing red flag, it will be showing you to see the systemic illness, because early recognition will significantly alter the prognosis of a particular case. Sertoli cell tumor is one of the very important paraneoplastic syndrome. Mostly it will affect dog which is having cryptarchid. Cryptarchid dogs are 10 times more likely to develop tumor on right side testis if it is a Sertoli cell related. If it is interstitial cell tumor, it may be on other side also. Here you may or may not observe bilateral alopecia. You can able to see gynecomastia in case of male dogs. Pendulous prepuce and enlarged nipples will be there. This will give us a clue, it may have some tumor inside. Lymphoma, again it is most common form of lymphoma is multicentric lymphoma. The primary sign is generalized lymphadenopathy. Apart from that, animal will show dull coat, scaling, crusting, pruritic and erythematous lesion. And cutaneous epitheliotrophic lymphoma, it will direct skin involvement will be there in this. Chronic itchy rash will be there. So coming to the conclusion, these systemic diseases, cutaneous manifestation of systemic diseases in dog is very important. So the dermatologist should identify actual cause. He can able to differentiate primary disease, that is the disease is in the skin itself, or secondary, that is some systemic illness is there, it is showing red flag outside through skin, because skin is the mirror, we can able to see the internal problem through skin. If some lesion is chronic and non-healing, definitely you have to think about systemic illness, and you have to see the pattern distribution, if it is a symmetrical illness or non-symmetrical illness. If it is a symmetrical, as I told, it may be allergic, endocrine or neoplastic, or it is asymmetrical, it may be external environmental cause, and even allergies also will have symmetrical lesions. Most of the skin disorders, if you are treating not cured, means it may be because of internal cause, you have to identify it. Thank you for the opportunity given.
Thank you so much, Dr. Mohanambal, for such an insightful and practical session. And now with this, it's time for our interactive Q&A. So if you have any questions for Dr. Mohanambal or the IAVD team, please drop them in the chat box. We will take one by one. And also, please don't forget to fill the Google form to receive your certificates for today's webinar.
Dr. Mohanambal, you can stop sharing.
Yes, sir.
Okay, so we have one question already there by Dr. Pundari. So is asking for treatment options for vitamin A deficiency flaky skin.
We have to give injection vitamin A on weekly basis.
Otherwise, 1000 IU per kg daily, we can give for 6 weeks. Like that, we can give orally also. Okay.
All right. So next we will take question from KD. He's asking what could be the reasons for Labrador 7 years old symmetrical pruritic alopecia on lateral sides of thigh, both ears and interdigital space.
So as such we cannot answer this question. We need to go with skin. If alopecia is symmetrical or non-symmetrical, we should not miss our initial diagnostic protocol. We need to do with the skin scraping first, then cytology, then biopsy or culture evaluation. If it is a 7-year-old, means you can think about endocrine disorders. Definitely you have to check out hypothyroidism and Cushing's. Hypothyroidism you can do with thyroid hormone assessment, and Cushing's, if it is a pituitary dependent, you will be able to see bilaterally enlarged adrenal gland, and if it is a adrenal gland tumor, you can able to see unilateral enlargement of the adrenal gland.
All right. So next question is there. How to deal with hypothyroidism suspected cases? Is human thyroid test okay, or how to interpret the results? Please explain.
Yeah. You can human total T4 and free T4 is giving better results for dogs, but human total T4 is better to come. The level is 1 to 4 microgram, but human TSH level won't match for dogs. If you are going to evaluate human TSH, it won't give right results for you. You can go with the total T4 assessment. If it is, it should be between 1 to 4 microgram. If it is less than 1 microgram, you can think that the dog is having hypothyroidism. You can treat it.
Actually, there is a Fiji is having the lab in that we have canine specific TSH that you can use. Whenever you use total T4 alone can be used for human lab. All others you cannot use. So this TSH have to see per.
So your voice is echoing a little.
Yeah, that's what I'm seeing. Why it has happened.
It's better now.
Yeah, actually that TSH always will have elevated in case of hypothyroidism. Sometimes it may not. So we have to check for if it is not elevated, if it is going to show normal, then we have to go for free T4. So free T4 has to be done with equilibrium dialysis. So it is not possible to do it in a human lab. So it is better to go with a canine specific. If it is going to be TSH and a free T4, you have to go for canine specific labs. And only total T4 we can use for human lab.
All right. So next question from Dr. Saurabh asking diagnosis and treatment of Cushing disease. So this is from Nothing. He's writing, use of ketoconazole is okay for Cushing's or any other protocols to follow?
Actually, it is not so effective in majority of the cases. So it is better not to go for ketoconazole. First and foremost thing is we have to identify whether it is adrenal dependent or pituitary dependent or iatrogenic. See, majority of the cases what we are seeing nowadays is iatrogenic Cushing. So you have to find out whether it is an iatrogenic, whether the owner is giving any steroid application. They may think only if you give orally it will go for Cushing. It is not like that, even injection or any systemic involvement. So there is a possibility to have the topical application for a long time with a steroid-based cream. There is possibility to pick up the iatrogenic Cushing. So in that case, we have to necessarily avoid the steroid application in any form. That is the first treatment. Whereas if it is going to be adrenal or other thing, then only we can go for treating the cases with the trilostine and the thing what doctor was telling that can be followed. Instead of going for ketoconazole, we can use the lot of drugs are available nowadays. But the tumor, we have to see the size of the tumor, what is the type of tumor, all those things. Even isotretinoin is going to help a lot in treating cases like pituitary. Majority of the cases what we have come across is pituitary dependent, pituitary hyperplasia or pituitary adenoma. So in these cases, even you can give this isotretinoin. It is there are reports stating that it is helping a lot. So we can
All
very
right.
well go for treating with the isotretinoin, that is retinoids.
All right,
But you
sir.
have to take care of the teratogenicity and also you have to take care of the trainers, all those things. If it is not available, other trilostane or anything is not available, but it is available nowadays. We have got even Panobiotech, they are having the product. And we have got even the Dacra, they have got Vetorin. Like that, we have got different products available in the market. We can very well use that.
All right. So we will move to next question. Is there any systemic manifestation of atopic dermatitis, and how can we differentiate it from other diseases?
Atopy usually will be there in skin. We may not able to see the systemic sign. To diagnose atopy, we have to go with Favor's criteria. So the onset, when is the onset, and animal rears in indoor or outdoor, and the lesion is glucocorticoid responsive or not, and there is a chronic recurrence is there or not. These kind of things we need to see, and the location of lesion we have to check it out.
Apart from that, we have to rule out infections. So we have to rule out infection, then only we have to apply criteria, particularly the microbes and also the parasites. By taking a skin scraping and cytology, we can rule out. After that, we have to go, and also we have to check ultrasound to see any cystic ovary is there. Even in that, it may mimic. Like that, we have to see the other involvement, which is mimicking the ventral distribution of the lesions. Even scabies will mimic, pneumotox will be mimicking. So these things will give a ventral distribution. So you have to rule out the infectious causes by way of scraping and cytology. Then you go for applying the criteria, favorite et al. Criteria. All the 8 criteria you have to follow and see whether it is having a minimum 5. That is the thing.
Okay, so next question is from Dr. Kundari. He's writing, please explain the dosing of thyroxine supplementation.
Thyroxine 20 microgram per kg body weight. You can go with once daily or twice daily dosage based on your how animal is responding. So you can go with twice daily dosing initially, then you can go with once daily dosing, 20 microgram per kg body weight.
All right. So next there is question from Rajesh Babu. So he's writing the symptoms here: alopecia, hindquarters erythematous, hyperkeratosis, lesions on face, wasting of the animal, pruritus. Now he's asking, please suggest basis on these symptoms.
We have to take investigations, take skin scraping, cytology, Then you come to a conclusion. You have to follow the rules. You have to follow the procedures. First, you have to see, apart from the distribution, we have to take the skin scraping. We have to do the cytology. See what is getting what you are getting from that. Then you proceed further. Otherwise, blindly, if you go by seeing a sign, it may not be a correct thing for approach.
Right. So next we have one more question from Dr. Simant. She's writing, my 5-year-old Spitz female, she whelped 6 months back and I find lesions on its skin under inner canthus of both eyes. What it can be?
So have you supplemented essential fatty acids, vitamin A, that you have to check. Because post-whelping, you'll be having a lot of a loss of essential fatty acids and vitamin A. So you have to supplement that and see whether it is showing improvement. Otherwise, we have to do the, if you are ruling out the metabolic reasons, then you can go for other causes by way of skin scraping and the tape impression.
Okay. So any standard lesions for canine dermatitis by distant vision before microscopic examination?
Yeah, canine dermatitis you can able to see from the distance. In case of scabies, the lesions will be crusty. In case of dermatitis, the lesions will be there around the periocular area, facial region. Sometimes it will be there all over the body. And animal don't have any itch, so the lesion will be non-pruritic.
Actually, here the actual when it will become pruritic means it will go for whenever there is a secondaries, it will go for pruritic. See, the secondary mostly with the staphylococcal infection, the staphylococcal themselves will act as a hypersensitivity reaction. So it will go for severe itching, as if it is going for excoriation, that is self-mutilation will be there. It will go for bleeding also. Scratching area, it will have bleeding in case of Demodex. And apart from that, the hyperpigmentation you can see in different areas. Whereas here, in case of scabies, you'll have non-stop itching. All the time it will have itching. Ear margin dermatosis will be there. And there will be severe, as he was telling, crusty lesions will be there. And ventral chest, all the extremities, elbows, all these areas will get affected. That is very important. And even the history of zoonotic, the owner will be telling, or the companion animal will be having involvement. That is the typical thing in scabies.
All right. So next question, what is the treatment for cutaneous adverse drug reactions?
Avoid the drug which is causing adverse reaction. The allergic reactions, allergic dermatitis, we have got three important things. One is we have to identify only by if it is going to have a pruritus, you have to check whether it is having a recurrence, that you have to check. Then if you are avoiding the allergens, whether all the symptoms are completely going away. These three are important criteria you have to check for allergic dermatitis. So the recurrence, pruritus, and avoidance of allergy will create complete subsidence of the symptoms.
Okay, all right. So next question we will take. Please explain how to identify hyperadrenocorticism.
That is what Cushing he was telling. Hyperadrenocorticism, as we have completely discussed about it, and even last time she only given a full lecture on it. We can very well go through in our YouTube channel, that our AVD YouTube channel is there. You can very well see that thoroughly about what is the adrenal dependent, what is the pituitary dependent, what is the iatrogenic, how to, because mere the history will be Cushing is that pendulous abdomen. Pendulous abdomen, certain breeds are very much prone for it, and obesity, all these things are, and polyuria, polydipsia. She was telling in her lecture also, in the previous lecture, about peas. She was telling about the peas, pot belly, polydipsia, polyuria, polyphagia. That peas are very important to check. That is a very important thing. You can very well, even if you miss the class, you can very well go for that AVD the YouTube channel. You can find out everything. Okay. Even this lecture also will be posted in the video channel, and our Dr. Nilesh will explain about it while giving vote of thanks. Thank you.
All right, sure, sir. So 1-2 more questions we'll take, and then we'll bind this Q&A session. So there is question for what is the treatment protocol for pemphigus?
Pemphigus, have to go with immunosuppressive therapy. Initially, you can give even prednisolone or azathioprine or cyclosporin or mycophenolate, mafetal. It depends upon the clinician. You have to suppress the immune system which is reacting against you. That's what important here, and you can even go with topical steroids and antibiotic if needed. Any secondary infection also is there, you have to go with, and sun exposure should be avoided. These kind of symptomatic therapy along with immunosuppressive treatment we should go for.
All right, thank you so much.
He also has to check for the thing which is causing. Sometimes even the garlic can create this type of pemphigus, or sometimes the drugs, like ciprofloxacin, amoxicillin, cloxacillin, which has been given some time back. You have to check the history. History is very important in this to rule out the other causes of how the pemphigus has been presented in this case, like that. So that also has to be considered apart from the treating cases.
All right. Thank you so much, Dr. Mohanambal and Dr. Nagarajan, sir, for patiently answering out all the Q&A questions. And now it is the time to conclude our today's webinar, and we would like to invite Dr. Nilesh for the vote of thanks. Over to Dr. Nilesh.
Very good evening, Team IAVD and Team Drools. And thank you, Dr. Mohanambal. You had been a very efficient speaker and a very good human being. Thank you, Team Drools, for organizing such a insightful webinar. And a special thanks to our President, sir, for giving a very helping Dr. Mohanambal in Q&A. And I would request all of you who are here in this webinar to join us at ICVD 5 at Kolkata from 4th to 6th of June this year. And we will be having very good sessions there. We have an international speakers. Many international speakers will be in that our international seminar. Kindly join us, and all the our lectures are basically uploaded in within 1 or 2 days of the organization of any webinar on our YouTube page IAVD. You can search it on YouTube. We have around 54 videos till now. We have uploaded everything. This video will also be uploaded within 2-3 days. So thank you all of you for joining. Thank you, Dr. Mohanambal, Dr. Nagarajan, and Team Drools. You all are doing very wonderful work. Thanks a lot. Thank you.
Thank you so much, Dr. Nilesh, and our esteemed speaker for today's webinar, Dr. Mohanambal, and also the President of IAVD, Dr. Nagarajan, sir. With this, we will conclude today's webinar. And before wrapping up, I would request to all the participants to please go and fill the Google Forms to receive your certificate of participation for today's webinar. And with this, we conclude today's session, and we look forward to you joining us for our future sessions as well. And good evening. Bye-bye.
Thank you, Doctor. Thank you.
My friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
all natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
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 Drools. Feed real.
Feed clean.